Honourable Swart.
Thank you, Deputy Speaker. The ACDP welcomes this debate following the shambolic procurement of the AstraZeneca vaccine. The lack of transparency around the rollout of vaccines must raise alarms, given the experience of widespread theft of PPE funds. Frontline healthcare workers were left without PPEs. Many succumbed to the virus. This is disgraceful. So it is critical that an open and transparent process is followed with the rollout of the vaccine program. It will indeed be a fertile ground for looting and corruption, with 25 to 30 billion rand estimated to be spent. This must be prevented at all costs by proper oversight and accountability by Parliament. Deputy Speaker, the ACDP would like to make it very clear that it is not opposed to vaccines. They've been shown to be effective against a range of severe and widespread health problems around the world for many years. Most people in South Africa have been vaccinated over the years and have benefited from vaccines. But with all vaccines, we consistently require that one, they're first proven to be safe and effective for the general population after rigorous scientific testing before being rolled out en masse. Secondly, they must be voluntary. And thirdly, the person being vaccinated must be fully informed by a qualified medical practitioner of the proven indications and contraindications of the vaccine before giving written informed consent to be vaccinated. Lastly, Deputy Speaker, it is incomprehensible why doctors are not permitted to prescribe ivermectin without following a cumbersome and costly application process for each patient. The medicine is safe for human usage and has been used worldwide for parasitic indications for over 30 years. The probability is that it can promote the treatment of Covid-19. Why is there this bias from first world countries against third world countries that are using ivermectin? Because it is safe, cheap, and widely available, there is an enormous pushback. One of the frontline doctors in the country, Dr. Kathrida, states, quote, "There is little worse than an attending doctor than to watch knowing that ivermectin is used by hundreds of millions of people, but the patient is unresponsive to every available treatment, but is showing promise in certain circumstances for the usage of ivermectin, but it is not available." This, Deputy Speaker, is a flagrant violation of patients' and doctors' fundamental human rights. And it is the reason why the ACDP and others, including many doctors, have had to resort to the High Court for urgent relief in this regard in order to save lives. I thank you.